Welcome back. Another day, another real life clinical case scenario. A 24-year-old female was brought to the emergency by her friend after being found unresponsive inside her room. At the time of presentation, the patient had shallow breathing, hypotension, and tachycardia. According to the friend, the patient had been on treatment for a psychiatric illness for the past few months. But the friend does not know what exactly the diagnosis was and what all medication she was on. And on the day of presentation, according to the friend, the patient spent most of the time inside her room and she was not responding to phone calls or knocks on the door. And when she opened the door, the patient was found lying on the bed, drowsy, and was unresponsive to commands. And on examination, the patient was febrile, dilated pupils, dry mouth, dry and warm skin, decreased bowel sounds, and altered mental status. An ECG was done and was showing the following findings.
The findings are sinus tachycardia. You can also see that there is first degree AV block. So why do I say that? That there are P waves which are hidden inside the T waves, which will be best seen in V1 and V2. You can also see that the QRS complexes are broad, which means that they are greater than 100 milliseconds. There is also a R dash wave or a terminal R wave in lead V1. In this ECG, if you see, you can appreciate that there is prolonged QRS complex. So it should be greater than 100 milliseconds. You can check this mostly in lead V2. You can also see that there is a terminal R dash wave. If this R dash wave is present, you can always measure the R dash wave and it will be usually greater than 3 mm in AVI. Also, you can check the R dash wave by S ratio, which should be greater than 0.7.
At this point of time, the patient also got an episode of generalized tonic-clonic seizures. Should suspect tricyclic antidepressant toxicity. Tricyclic antidepressants were used commonly for depression, migraine prophylaxis, and also for obsessive compulsive disorder and neuropathic pain as well. But nowadays, due to much safer alternatives, it is prescribed less commonly. The risk associated with the tricyclic antidepressants is that the narrower therapeutic index it has when compared to SSRI. Tricyclic antidepressants work by inhibiting the reuptake of both noradrenaline as well as serotonin in the central nervous system. In cases of toxicity, the TCAs block a number of receptors including the alpha-1 adrenergic receptors, the histaminic receptors, the muscarinic receptors. The blockade of the alpha-1 adrenergic receptors causes hypotension, and the blockade of muscarinic receptors causes anticholinergic effects like tachycardia, fever, dry mouth, dry and warm skin, decreased bowel movements or sounds, altered mental status, as well as dilated pupils. If the QRS is greater than 100 milliseconds, then it is more predictive of seizures, and if the QRS is greater than 160 milliseconds, then there is a chance of VT.